All right, everyone. Welcome to another episode of the Equity Circle podcast. It's a video edition. I'm very excited to have some guests that we've had previously, but now we get to have them on both at the same time, which is very exciting. So I want to welcome Chris Bischoff and Dr. Steve Krager to the podcast. Welcome.
Thank you.
Yeah, thanks for having me.
Of course. Well, our audience does know you from our previous podcast, but why don't we just do a brief introduction? Why don't you just tell us a little bit about yourself and maybe share something personally as well? So I'll start with you, Chris.
Thank you. I'm the Health and Human Services Director for Wahkiakum County. Interestingly sized agency considering the size of the county. We do a lot of things there, including we have a behavioral health clinic, and we run the transportation system in Wahkiakum County. Well, we run the bus side of the transportation system. And then on the health side, obviously, we also do a small clinic for that as well, and all the rest of the public health stuff we're supposed to do. I've been in public health for just shy of 20 years now, and actually in Washington State doing public health for just shy of 16 years. So born and raised in Las Vegas, too hot, too crowded. So I love it up here in Southwest Washington. Purposely, when I was looking for a position, I looked for areas in Southwest Washington that were hiring, and the neighbor to Wahkiakum, Cowlitz, actually brought me up here. So
that's very different from Las Vegas and Wahkiakum County.
Very, very different.
Yes. Well, I'm glad you enjoyed it. All right, Dr. Krieger.
Yeah, my name is Dr. Steve Krieger. I am the Deputy Health Officer for 6 counties in Southwest Washington. Let's see if I can name them all quickly. Skamania, Clark, Cowlitz, Wahkiakum, Pacific, and Lewis counties. So I'm a physician with public health experience. I've been the health officer for Columbia County, Oregon as well in the past. And I have training kind of specifically in public health. So I did a residency in public health and preventive medicine. So this is the work that I'm passionate about. Something personal. I have 3 kids. One is 7. The other 2 are too young, but I am excited. I think we're going to talk about COVID-19 vaccines. And he has an appointment on Sunday to get his first vaccine, which I'm really excited about. I'm excited about for the other kids, but it's nice to get that process started.
Well, that is very exciting, and that kind of leads, directly into what we're going to be talking about today, in terms of vaccinations. So I want to kind of preface this. I know that for some this issue can be controversial, but I think it's important that we talk about vaccine mandates. And, both of you are in the public health spectrum and understand the necessity of it and understand the history of it. And that's really kind of what we're going to be talking about today. So I'll start with you, Chris, and then I'll give a chance for Dr. Krager to answer as well. I think it's important for people to understand from a public health perspective, and just in general, the history of vaccine mandates and when they began. So Chris, can you talk about the history of vaccine mandates and when those began?
Absolutely, and looking forward to Dr. Krager's comments on that as well. So, first, before I jump into that, if I could, I understand this topic is deeply personal for a lot of people, and I certainly, and many of my colleagues have been accused of being tone deaf on that because we come at it, I think, pretty strongly and pretty unequivocally in favor of it. I think the reason for that is that most of us see this and see the data as leaving very little room for doubt. In fact, in my mind, no room for doubt. So I do want folks to understand that I understand this is a very personal issue, and that people have a variety of reasons why they may be hesitant. But that being said, I think the science of it, the medicine of it, and the history of it all speak very strongly in favor of vaccinations and their importance to our society, our public health. But when I was going to school, and I know Dr. Krager would mirror this, we learned a lot about what started out as inoculations, really, as the first sort of vaccination efforts, and those sorts of things. But going back and brushing up, just reminding myself some of those things. So The Chinese and other cultures actually began inoculations back around 1,000 years AD, 1,000 AD, sorry. So we're looking at over 1,000 years old. That, of course, was a very sort of a little more dangerous version, where you actually used a less pathogenic version, specifically smallpox, to inject people with. We've come a long way, and I think that that's an important part of this too, is that the mRNA vaccines and the Johnson & Johnson version, the DNA vaccine, are so much more efficacious and so much more safe than we've ever had in the past, that it just really is a leap and a bound. But one of the interesting ones that I actually wasn't aware of and came across in my research was that George Washington actually inoculated his army right during the Revolutionary War. Most of the British troops had been exposed to smallpox somewhere else in other fighting, and so carried around that sort of immunity. Others had been inoculated, but largely the colonists hadn't been exposed to smallpox and were not inoculated for it. And so he actually mandated all of his troops be inoculated. And Benjamin Franklin and Benedict Arnold both commented prior to his decision that this was probably what was going to lose the war for the colonists, was the lack of immunity to smallpox. So that I'll let Dr. Krieger jump in.
Yeah, it's kind of fascinating when you look at the history. Yeah, I wasn't aware until recently of the Revolutionary War kind of piece as well. And, yeah, some people think we wouldn't have won, or the colonists wouldn't have won if that had not happened, and, the army would have been decimated by smallpox. So that, I think that was kind of the first example in the US with smallpox, and the first kind of like state to do compulsory vaccination requirements was Massachusetts in 1809. And so they required everyone in their state to get vaccinated. It was kind of hodgepodge after that. Not all states did it, but Massachusetts was the first. We didn't really get a lot of court kind of decisions about the constitutionality until I'm trying to remember the date. I want to say 19. Oh, now I'm forgetting.
It was 1904.
04. Thanks. Yeah, thank
Supreme
you.
Court, 1904. Yeah.
Yeah. So the Supreme Court in 1904, Jacobson versus, again, Massachusetts. This was, someone, Jacobson was someone who didn't want to get vaccinated. And this Cambridge, Massachusetts, the city, required smallpox vaccination or get fined like $5, which was like, $150 right now. So he was fined, and he appealed that all the way up to the Supreme Court. And the Supreme Court, in a 7-2 decision, upheld the vaccine requirement, saying this is a power that states have, that government authorities have, in order to protect the public health. So they kind of understood that, we're weighing an individual liberty, absolutely, with kind of public good. And so that is often kind of pointed to as the main example of, courts deciding that the government or the state can require vaccines. And that's been upheld a couple other times with like school requirements for vaccines as well. In general, there hasn't been, at least going up to the Supreme Court, anything overturning those sort of requirements. So if we go a little bit further along into history, there's, again, it's kind of waxed and waned about how many requirements there have been. But the most recent history was in the 1970s, I believe, with a lot of states enacting requirements for schools. So especially with kind of measles in the 60s spreading, and polio prior to that, and causing a lot of, tens and thousands of cases of measles in the United States. And then after the 70s and into the 80s, those measles numbers just plummeted. after those requirements went into place. And we saved a lot of lives. And now we, pretty much all states require a certain set of vaccinations to get into schools. That's where we see the most, vaccine requirements. Some businesses have requirements as well. Healthcare workers are certainly required to, sometimes have hepatitis B, other vaccines like that, influenza, but probably where we get the most coverage and the most benefit is with the school requirements.
So one, I want to thank you for that. This is very fascinating listening to you both share information about this. And so, just kind of to summarize some of what you shared, it really sounds like, I'll just speak first just to our own country. It sounds like really from the beginning, there was a varieties of ways that we incorporated vaccines and vaccine mandates in order to protect people. And in order to, Dr. Krieger, you said that I believe it was in the 1904 case that there was opportunities like for the government to utilize something as a means to protect people in public health. And so, which kind of course, we run into that quite a bit with COVID now. So I just kind of want to ask a follow-up question. How did we get to where we are now with mandates? I know you've shared, schools and things that have happened in the 60s and in the 70s. And so, and can you kind of both share? I'll start with Dr. Krager, if you can share just about how we've gotten to that point with COVID-19.
Sure. So, it was interesting. I think late 2020, the COVID-19 vaccines were being developed, and we were getting, really good data about their efficacy and their safety. And there was a lot of excitement, right? I mean, we were in the middle of a terrible winter of COVID-19, kind of our worst surge to date. And lots of people dying from COVID-19. And now we have, potentially vaccines coming that could, in a lot of people's minds could end the pandemic. So there was a lot of excitement. There was concern as well among people kind of in public health, as well as kind of across the political spectrum, that, was this happening too quickly? How were they developed so fast? Those questions were always there. I think what's been interesting is that if you talk to people in public health and medicine, they've become very satisfied with the safety processes that were in place, the data that's come out of phase 3 trials, all the trials that have been done with vaccines. But for a lot of people, those concerns kind of never left, right? And it's been amplified by, I don't know, lots of different people have amplified this anti-vaccine message, kind of preying on those, I think, legitimate concerns in a lot of ways, but not filling in people with kind of the full story about, how we monitor safety with vaccines and how effective the vaccines are, especially in preventing hospitalization and death from COVID-19. So just from my perspective, kind of in the public health world, there was at least the hope that, hey, if we show people this data, people will come around and people will get vaccinated. They'll realize it's the safest thing to do for their health. And it doesn't matter whether you're 80 or 25, the right thing to do is to get vaccinated. Even if your risk of severe COVID-19 is not super high, it still makes sense to get vaccinated. And that's clearly what the data shows us. And I agree with Chris. There's no question in my mind that the benefits of getting vaccinated against COVID-19 outweigh any potential risks from the vaccine. So, we had hoped that we could convince people, right? There's tons of different types of information out there, right? And sources that people read or listen to. And depending on, the sources that you listen to, you could be easily convinced that the vaccines are terrible, dangerous things. And that, there's conspiracies and plots to harm people or prevent fertility or all these, other kind of things that we hear. So I understand why people have been hesitant, especially if that's where you consume kind of media in those places that are sharing that information. It's the logical thing that you would do if even trusted, people get doctors that say these things, and so you can point to that and say, look, this doctor is telling me that it's dangerous to get vaccinated. Why should I listen to you instead of this other doctor? And so against battling all this misinformation that's out there, a lot of people have listened to that information, not the information that we've tried to share, that we think has the scientific community behind it, and decided not to get vaccinated. So I think there was a lot of hope initially that why can't we get 90% of the population vaccinated? That would, maybe it wouldn't eliminate COVID-19, but it would drop it to such low levels that we wouldn't need to worry about it anymore. As 2021 progressed, as the vaccines became more widely available to anyone who wanted it, it became clear that there were kind of, I think, two kind of segments of the population. A small segment that is very anti-vaccine, especially anti-COVID-19 vaccine, and will never get vaccinated. And then a larger group of people that I think has been chipped away at over time, but a larger group of people that are mostly indifferent, and that are kind of worried, but maybe not that worried about what would happen, but also are not that worried about COVID-19, and so just don't really feel like getting vaccinated, or at least don't want to, make that step. And I think that's where mandates have kind of come in, is reaching, I think, the larger group of people who are a little more indifferent, but would get vaccinated if they had to, to keep their job or something like that. And we first saw mandates with some healthcare systems, which makes sense. There's been transmission in long-term care facilities and in hospitals, people dying from getting COVID-19 either in the hospital or from coworker to coworker at a hospital. And those were kind of the first places to institute them. And then since then, we've seen states step up and do some of their own, requirements for healthcare workers or teachers. And that's where we're at right now. And then, and obviously President Biden making a rule, OSHA making a rule, right? Which we're just getting more details about, requiring businesses with over 100 people, 100 employees, to either get vaccinated or get a test weekly. That is being challenged in court, and we'll see what happens with that. But based on the history of, what the Supreme Court, which, they rely a lot on what has happened in the past, I have a feeling the mandate will stand, or the health and safety requirements will stand, but obviously I can't say that for sure. So that's a little bit, kind of where we were and where we are at now.
Yeah, and in total agreement with Dr. Krieger and all of that. I think one other aspect of this, that, and kind of why I started off the way I did. There's two parts to a vaccination. There is your own personal choice of whether to have one or not, but there's the ramifications of that are societal. They're not your choice. So that's tough for people to hear, and I've tried to figure out about 1,000 different ways to say that would make it go down a little smoother. But the essence of this mandate is that to really get COVID and sort of relegate it to the trash bin, we need a ton of people to get vaccinated. So I've often been asked that question of, you're vaccinated, I'm not, why does it matter to you? It matters to me because I'm here to protect public health, not just mine. I made personal choice about getting vaccinated. As Dr. Krieger talked about early on, many of us were very concerned about how quickly these were being developed. It was a good chance for us to go review the process of how vaccines are reviewed and why they're safe, and specifically for these new types of vaccines. But having made that effort to do that and find the information and see the overwhelming information in support of it, then knowing that not only am I protecting myself, but I'm protecting my family, I'm protecting my kids who can't get vaccinated. I'm protecting other adults who can't get vaccinated. To some extent, I'm protecting people who won't get vaccinated. So that smaller group of hardcore anti-vaxxers that Dr. Krager was talking about. And I think that's, again, I understand that's a hard message for people who are choosing not to get vaccinated to hear, but I think it's important that one of the, the main impetuses of a mandate like this is that you have to get that number high enough for it to do good for everyone. And I think the Delta variant is a good example of that. Obviously, that really started popping up before we really had widespread vaccination available. We saw it inoculate or kind of take over in India and then move out across in other areas, including the US and the UK. But that's a great example that if you continue to leave those environments where the virus can freely mutate, then you have a chance of having a virus mutate that is going to more ignore current vaccinations. And that's a problem that makes a perpetual issue for all of humanity, not just for small groups, unfortunately. So it really is about sort of stepping outside of ourselves and embracing a community health perspective that we can all help each other live more healthy lives. And I think that's, for me, one of the key takeaways that I really struggle with trying to communicate in a way that people know that I hear them about their personal choice. I do hear that, but there's a larger issue that I would love for them to hear as well, which is you're making a personal choice, but you're also making a choice for everyone around you. And I think that is something that we need folks to understand. I would look at it in a lot of ways that we look at other public safety issues, that you're making that personal choice, but it really affects a ton of other people. So do you wear your seatbelt when you drive, or do you keep your car and brakes running well, and your tires, right? That's a personal choice whether I replace my tires or not. But when I go to stop and can't, then I've made a choice for people around me as well. And so I think that if we could get that to be, I think part of the focal point too is it's less. Nobody likes to be told what to do unless you join the military, because apparently you do there. But generally we don't like to be told what to do, and so the mandate feels uncomfortable to a lot of us, and I get that. But it's really what the impetus for that is we're trying to protect large swaths of the public, not just individuals. And I think that, for me, kind of sums it up. But
yeah, so it sounds like kind of what you're getting at, Chris, is like it has to be normalized, kind of like like anything else, really, like speed limits, or like you were talking about with taking care of your car, or wearing your seatbelt. It's something that it should be normalized, because it is something that it is a personal decision, but ultimately does affect other people. And kind of what I'm hearing from you both is that this getting to the point of where we are with the mandate was really, the vaccine came out, there was concerns about how quickly it came. It sounds like you both did research and tried to understand it better, saw that really this was a safe and effective vaccine, and then that we've seen that time and time again. But as over time, there have been people who either are against the vaccine, or just like you said, Dr. Krieger, really just maybe so more just nonchalant, or just it's not really leaning one way or the other until mandates came into place and really made that final push. And so kind of what I'm hearing from you is the mandates were really there to protect other people, and they were also there to continue to reach those that are not getting vaccinated, in order to help us move forward past this. Would you both say that's a kind of a fair summary, or is there anything else you wanted to add to that?
I think that's fair.
Okay. So we've talked about a little bit about the history of vaccine mandates. We talked about the kind of how we've gotten here. Can you share, I'll start with you, Chris, this time. Can you share really the necessity of this? I mean, we've kind of touched on it a little bit, but is this mandate really beneficial and is it necessary for people to get the vaccine? And so I'll start with you, Chris, if you can share that.
Yeah, absolutely. Well, and the short answer to the question is yes. I could stop there, but I won't. Uh, I think there's a sense that we've had enough people get sick in the U.S., and so therefore they probably have some natural immunities, and a bunch of other people get vaccinated, and some that have had the opportunity for both. But I think what people are overlooking in that is our hospital systems, our professionals that are involved in this are stressed to the end. The most recent wave really did a number on hospitals across the country again. For many areas, that wasn't the first time it had gotten that bad, and it came very close in the state of Washington to breaking our system. I mean, some would argue that there are examples in Washington of where the system broke. But that's not the first wave they've had to deal with. That's, the third decent sized hospital wave that they've had. And so it really is that we have to get this under control. Our systems are stressed to the end of their ability to function. We've been bleeding doctors and nurses and admin professionals and public health professionals and all aspects of that during this whole pandemic. People that were within a few years of retiring or had another career they could go to have done that. And that continues to happen. And we're just seeing that sort of fatigue and burnout just continue to grow. So I think you could pull that out as a solo reason why we have to get more people vaccinated. We really have to shut this down. But there are a bunch of others as well. I talked about the idea of having these huge populations of incubators that we can then have the disease mutate more effectively. And by effectively, I don't mean I'm cheering them on, but as in their ability to mutate, which can go all kinds of different directions. If there's no pressure on a system for how they mutate, then they mutate in every possible direction generally. And so we really have to reduce those places where the disease has opportunity to multiply rapidly and spread rapidly. And so, yeah, that makes those two things make it absolutely necessary. There are more, and so I'll leave some for Dr. Krieger.
Yeah, I completely agree. I mean, we have a new novel virus that just in the US alone has killed over 750,000 people. And I would hope people can think back to like April 2020 and, where people scoffed at, 60,000 people dying from this virus. And we've had so much death. And we're talking about primarily older people, but not just older people. When you talk about I've looked at some estimates of years of life lost due to COVID-19 in the US. It's in the millions. We're losing millions of potential years from people's lives that died too early, that would have lived longer, 10 years, 20 years, 30 years longer. People who are parents of young children, people who are grandparents. I saw another study that, it was over 100,000 kids in the US have lost a primary caregiver. So either a parent or a grandparent that was directly caring for that child. And we need to do whatever we can to prevent more of that. And the vaccine is our best way to do that. And enough time has passed that, we have to try something else to get people on board. And I think what we can look at is the examples so far is that the vaccine mandates are working. They are getting, depending on kind of where you're looking at and how the organization does their exemption process, we're talking about, getting 95% of people vaccinated in a lot of places and a small number of people with exemptions. That is huge. And not only are we talking about, globally or in the US preventing a lot of deaths, we're talking about all the disruption prevented in businesses, in schools, kids being out sick, coworkers being out sick, outbreaks happening in facilities. And I think, you know, the one thing I appreciate about the OSHA mandate is it's making it a health and like a worker safety issue. So I think it's absolutely true. Countless outbreaks that I've worked on in businesses where people have died because COVID-19 was spread within their facility. And then this facility is beyond, you know, the safety of their workers, talking about, you know, thousands of hours of work lost, countless amounts of money due to this disruption. It just makes sense to try to protect workplaces in this manner. And I think the other thing I would point out is you can get a test if you really, really feel that you do not want to get vaccinated. You can get tested weekly, and that is an option. So no one is going to hold you down and make you get vaccinated. You have a testing option as well. I think it makes more sense to get vaccinated. I think it's safer to get vaccinated for the workplace in general, because we know testing doesn't always prevent all transmission. It can certainly help, but that is an option as well. And I think sometimes people just focus on, well, you know, you're just forcing people to get vaccinated. And actually, there is an option there. There's a testing option as well. So that's kind of my perspective. I think we still have a long ways to go. And Chris's point about variants and mutations happening is really important. And it is where Delta came from. It places basically anywhere where viral replication, so viruses are making copies of themselves, there's a chance for a mutation to happen. That could be a bad mutation for the virus, it could be a good mutation for the virus. It makes it cause more severe disease, could make it spread more easily, which is what happened with Delta. So if we want to prevent that from happening, by far the easiest way to do that is to get people vaccinated and try to drive viral replication down as much as possible. Again, I don't think anyone thinks we will completely eliminate COVID-19. We'll always have, hopefully, a very low level of it kind of spreading in the communities. But if we can drive it really low, we can maybe it'll be another 10 years before we see another, you know, variant that is significantly different than our current variants if we drive transmission low enough. So that's a huge goal, and I think it's really important.
So I think, you know, what I'm hearing is that the necessity of a mandate, the necessity of asking people to get vaccinated and requiring people to get vaccinated is because of the dire situation that we're in, because of the lives that were lost, because of the ways that it's affected us as a country. Not only, you know, we talked about the lives lost, but I know Dr. Krieger also talked about you know, money that businesses lost and hours that people missed work. We can have a whole nother episode talking about mental health and how that's affected people. So I think, you know, what I'm really hearing is just how it's affected people in so many different ways. And so requiring a vaccine is really to protect us all and to help us try to move forward past this is really what I feel like I'm hearing from both you, and I've really appreciated the opportunity to talk with both you and share, hearing you share about your thoughts and what you understand about vaccine mandates. And so as we come to a close today, I would just love if I'll give you both a chance to just share any final words or encouragement as we come to a close today. So Dr. Krieger, I'll start with you, and then we'll close with Chris.
Yeah, thanks, Lawrence. Thanks for having us. I think this is a really important discussion. One thing that I've noticed lately, or that's been apparent to me, is that the stories we're hearing and the misinformation that is out there, it's not new. These things we've heard about the COVID-19 vaccines and the stories that people latch onto and try to promote, it's kind of been in the anti-vaccination playbook, honestly, and it's being co-opted. And so what I would encourage people to do is kind of think about your attitudes towards vaccines in the past, prior to COVID-19, prior to hearing all this junk that's out there. How have you felt about vaccines in the past? Did you get vaccinated against the flu? Did you get vaccinated against measles when you were a kid or more recently? Polio, pneumonia, all these vaccines that, you know, you feel comforted that you've had. Think about those and then try to consider that the same process has been gone through with those vaccines as with these vaccines. No steps were skipped. It was done quickly because of the urgent need that we had. So I would just encourage people to step back a little bit and kind of think about, you know, where you've been in the past in regards to your feeling towards vaccines, and try to apply that to the COVID-19 vaccines, and try to guard yourself a little bit against this misinformation that's being co-opted by a lot of people, including, you know, people who've been anti-vaccination their whole lives and have made careers out of it. Just be a little bit skeptical of some of those things that you might hear. I think that can go a long way, and hopefully make you more comfortable if you are faced with a requirement at a workplace or school or something like that. You know, feel a little bit more comfortable that it's the right decision to get vaccinated. I think that could help people.
Yeah, and thanks again for having us. Echo a lot of what Dr. Krieger said, well, all of, obviously. You know, one of the things, and I did hit this a little last time we talked. I think this mRNA technology, folks don't understand the power behind this. It really, going to school, you know, as a biology degree, and taking genetics and understanding the power that is available from this sort of technology. Already, some of the bigger players that have, like Pfizer and Moderna, that have this technology out are just looking at it tons of different ways that it's going to just positively affect people's lives. So I think a lot of those people who aren't anti-vaxxers are going to become more and more comfortable with this technology over the next 5 or 10 years, because it's going to become more and more common. You're going to see it in more places doing more things. Vaccinations, yes, for things that we haven't been able to get vaccinations for, including HIV, which is, I understand, pretty close. But even more common things as well, and also as a treatment option for other things. Cancer is one that keeps getting talked about, and there's some interesting developments along that where mRNA technology is going to potentially be able to make a major impact on cancer. So I think, you know, when I look in the crystal ball, people will become very comfortable with this, the same way they are with, say, antibiotics now, which at one time were new and were scary for a lot of folks. It will become a very commonplace thing. And my purpose in saying that is if folks will look at the data that's out there now and the availability of that technology or the potential of that technology, I'm hoping that it can get a few people to understand that this is going to become a common part of life for many of us, and come to a level of acceptance much quicker that way. When I first heard that the mRNA vaccines were in developments for this specifically, my initial reaction, because they were being talked about 30 years ago, my initial reaction was, no way, they'll never have it ready in time. Not that the technology couldn't do it if they could figure it out, but no way they could. And when I heard that they actually had a vaccine that was going through trials and working well, honestly, you can ask many of my staff, I just geeked out on a regular basis on them about it. It was very exciting for that. Obviously, still a lot of questions about how safe it was, and that's where you know, doing a lot of research and looking into the process for approval and all those things, as Dr. Krager has talked about, calmed those down in my mind, and sort of equalized with the excitement for the potential of this. And so people ask me, is there a silver lining to the pandemic? If there is one, for me, that's the silver lining to the pandemic, is we were able to put a lot of money into developing this, and there had already been a ton of work done. I don't want to, this didn't go from zero to done overnight. It had been progressing quite steadily for quite a while. But we really were able to take that final leap because of all the effort, money, and everything else put into it. So I think it's something that will benefit humanity in the long run, that technology will. And so that's sort of my hope, my hopefulness that I cling to, is that it really will become something that helps us out, and maybe as far as medicine goes, the next antibiotic. When antibiotics came along, they were huge and life-saving, still are. A major change in medicine. I think that you can see something similar to that potentially with this technology. So I hope folks will take the opportunity now to get more comfortable with us, with it, and help us out of this pandemic a little faster, because I think most of them are going to become comfortable with it over the next decade or less. So.
Well, that sounds like a good note to end on, and feeling hopeful not only for this vaccine, but Chris, like you were saying, for the future of medicine and technology with mRNA. So thank you for sharing that. Thank you so much to both of you for taking the time out of your day to do this. I've been listening to Chris Bischoff and Dr. Steve Krager talk about history of the vaccine mandate. I want to thank you all again so much for your time. Thank you to our listeners for always listening and sharing your thoughts. We always welcome that. Please remember that equity equals progress. Thank you.